to start talking.
I'm not quite. So good afternoon and welcome to the first of our extraordinary AGM activities of the week. And what a wonderful way for us to start our AGM week. So my name is Rachel and I'm incredibly proud and privileged to be the Chief Nurse here at East and North Herts Trust. Just a couple of quick housekeeping points to share before we start. So firstly, I wanted to confirm that we are ensuring that all the staff in this room are at least 2 metres apart, and we are adhering to all the social distancing guidance that we need. Secondly, as we go through this presentation over the next 45 minutes to an hour, I'm sure that you will all have lots of questions and queries that you would like to ask myself and my colleagues that are here to talk about the work that we have been doing. Please send them in and make sure that you vote for the most favourite question that you have. If we don't get an opportunity to answer all those questions today, we will get back to you at some point with those answers. The invisible voice in the room is David, and he will be asking us all of those questions throughout the session. So to our presentation today, you'll all be familiar with our ambition and commitment to put our patients first. You'll also be aware of the extraordinary efforts that each and every one of us has gone through in response to the COVID-19 pandemic. Over the course of the next hour, we'll be sharing with you the work that we've done to ensure our patients, their families, and carers continue to be supported to keep in touch with their loved ones during times of most difficulty. We're also going to share a patient's story and a video that illustrates the work that colleagues here, Ruth and Jodie, have done. After the video, Jodie and Ruth will share with you some of the highlights of the work that they've taken forward. So now, without further delay, I'd like to introduce Tony and Lorena. They are here to describe to you the impact of our Family Liaison Clinician Service and the impact it had on them personally throughout the recent COVID time. Immediately following the video, Jodie will step into this space and we'll start to talk to you about the presentation and outline the steps that we've taken. Thank you.
When COVID-19 hit, one of the
So thank you for allowing us to open up this year's AGM. It's been a privilege to be able to share our story. As a reminder, my name is Jodie and I'm the Carers Lead at Eastern North Hearts Trust. What I want to do firstly is just remind ourselves of what it was like at the beginning of April, because life has certainly moved on and it's starting to feel like normal now. But the events of 3 months ago was beyond our comprehension and beyond anything we've ever experienced before. We had no idea how long or the effect of the pandemic was going to have, because we've never seen anything like it before. But what we had seen was what was happening in other countries. And then all of a sudden, our community shut down. There was panic buying and empty shelves in the shops. We could no longer visit our families and friends at home, and this also extended into the hospital, with visiting being severely restricted. For everyone, there was a real sense of fear and uncertainty. For us in the hospitals, we underwent immense change on a daily basis. Staff were working on unfamiliar wards with different specialties and different teams. We were doing active recruitment of additional workforce to help support our patients. Wards were being reconfigured to manage longer, and we also had to be creative to find solutions to things that we had not seen before. All the workforce had to undertake extra training to ensure the safety for everybody. And then, of course, there was new technology we all had to learn. And all this was happening whilst dealing with high numbers of very unwell and highly dependent patients, and we had to adapt quickly. When visiting was restricted, we realised that our patients, who were unable to communicate independently with their families, we had to do something differently. Our patients were too unwell or had other conditions such as dementia or learning disability, which limited their ability to communicate without assistance. And we had to support them in a new and different way. And we also had to ensure the communication continued between our patients and their families at home. Some of our high dependency areas quickly set up processes to communicate with families, such as critical care, respiratory, palliative care, and renal. What was apparent on the general wards and the pop-up COVID wards that this process would also be of benefit here. Families weren't being unreasonable in wanting to have conversations, as they could not see for themselves how their loved ones were faring, and this increased their anxiety. Delivery of patient care was a priority for the ward team, leaving little time to communicate with the families due to the acuity of the patients. We realised through visiting the wards and talking to staff, what really mattered to them was being able to give the families the time on the phone that they really needed to have all their questions answered and reassurances given. As a result, and learning from the other areas of the hospital, we set up the Family Liaison Clinician role to help support wards that had this extra need. Ruth and I tested out the delivering of this service for a few days on 2 wards, which included a telephone script and the fundamental question of what mattered most. What we found was the staff felt relieved that they could focus on the hands-on care while we were helping to support them with their phone calls. We contacted the families that we supported in this initial couple of days to get their feedback, and they were so grateful that we had proactively called them and they knew to expect our call each day. Of course, if something changed, the ward would independently contact the family, so they felt reassured that they were always connected. We recruited more nurses to support the ward, further wards. Patients, Bridget and Miriam, were part of the redeployed workforce, and they were fundamental to the success of this work. Next slide. The reason we took the what matters most approach was because Ruth and I had both experience of using this as a tool in previous work that we had done. The what matters most to you approach is an improvement toolkit that was launched by NHS Improvement in 2016 to encourage and celebrate more meaningful conversations with healthcare professionals and the people we care for. We wanted the shift of the focus from what is wrong with you to what actually matters to you. This helps support the development of high quality, compassionate support, care or treatment focused around what the people really need and want. As part of the development of the Family Liaison Clinician role, we added the question to the script that we had designed. We knew these calls to be important to family, so we wanted to ensure the quality and consistency of communication. We asked what mattered most to the patient who was in our care and asked what mattered most to the family member who was supporting them at home. In this pandemic, where everything had changed, we felt a real responsibility as a trust to keep our hospital connected to the community, and the what mattered most question really helped us to do this. So just before I hand over to Ruth to continue the presentation, we are going to hold a poll to find out what matters most to you. So if you could fill in and answer that, we'll be able to use that as part of our discussion in the question and answer section. Thank you. And I'll hand over to Ruth now.
Okay, folks, this is David here, just intervening very quickly while Ruth prepares herself. Just to remind the audience that you can pose your questions by clicking on the Q&A tab 2/3 of the way up the screen on the right-hand side. So please do that. Once you've clicked on that tab, right at the bottom right-hand corner of the screen, there's a plus icon. Click on that and that takes you into the place where you can ask your question. And please remember also to vote for your favourite questions, and that'll drive what I then ask of the panel. Thank you.
So my name's Ruth. I'm going to talk to you about what we found when we asked that fundamental question. What we realised very quickly was that listening was really important and acknowledging what it felt like to families who were unable to come in and visit. We understood how important it was for families to feel connected. And due to lockdown, when the patients came into hospital, either from home or from a care home, the families hadn't been able to see them for a while. And the rich conversations helped us to understand the patient as a person. We got to know about them in their role of mum, dad, grandparent, sibling, friend, and we learned what was really important to the patient and their loved ones. And this information enabled us to deliver more personalised care. And what we as health professionals thought was important often wasn't the most important thing to the patient and their family. So our goals and focus might be around treatment and their mobility. Of course, this is really important. However, when we were able to use what we learnt, it can lead to a huge difference to the patient's physical and emotional well-being. So for example, Tom can't hear unless he's got his hearing aid. Tom has just become a great-grandfather. And we pass this information back to the team looking after Tom. And when staff personalised their conversation with Tom, it gave him a real lift to his day. It helped him to stay positive and looking forward to getting home. And it made him more motivated and engaged with his care. So it was important to know the names of family members, the birth of a grandchild, or someone's birthday. And sometimes we think, by asking what matters most, we won't be able to deliver what's been asked for. However, our experience was that we could almost always do what mattered most. Our conversations varied in length, and our role was to listen. The nursing and medical staff were working non-stop to deliver patient care. But in our role, we had the time to listen and talk and share what we'd learned with those delivering the care. And everybody knew what mattered most. So this question gave us real empathy for our patients. It enabled us to look beyond the ill patient in the bed, to understand more about them and their family. And for most families, what mattered was having an update on their daily care. How was the patient feeling? Had they eaten? Had they been out of bed? Could we pass on a message? Could we help with a phone call? And families felt confident that they were still involved with the treatment plan, as we would share what we'd learned from the conversations with the multidisciplinary team staff. And the staff really valued this so that they could incorporate it into the patient's care plan. For example, if a patient wasn't drinking very much, when we understood that Fred didn't like drinking plain water at home, we could make sure that he had some orange squash added to his drinking water. And this in turn improved his hydration and improved his outcome and his comfort. And in the film, Jodie referred to the couple who loved their daily calls, and this was really important for this gentleman's well-being. A daughter that I spoke to told me that her dad would really hate to be in a room on his own with no background noise. And so we made sure that there was a radio in there, and we asked about the type of music that he liked to listen to. One family told me that it mattered to her dad to read the daily paper. So at our multidisciplinary team meeting, we had a plan for who would make sure that he had this. And this helped the patient to keep connected to the outside world, in addition to relieving the boredom of a long day in hospital. So at the peak of COVID, it was so intense, but we finally got some time to reflect on our learning. And we know that we need to keep connected to our local community. We're taking forward what we all feel is really important to our patient and their family's experience, and the things that add value and the things that should always happen. Those what matters most conversations are essential if we are truly going to be able to deliver patient-centred care. And from the conversations, we know that it's not always medical advice that families want. It's far broader than that. And by understanding what matters most, we will focus on making sure that the most appropriate person is involved with the conversations. This might be the clinical support worker who's given the patient a wash, helped them to drink their cup of tea. Or it might be the therapist who's helped them out of bed and got them mobile again. Or it might be the social worker who's arranging the discharge, or the doctor about their medical treatment. We know that conversations are really important, and there's real value in being proactive in communication with families. And you could hear the relief when we'd make those calls and we'd say, "Hi, it's your family liaison clinician here." So we'll continue support to ensure that all families are able to stay connected via phone and video calls. And we're taking forward a shared purpose and all working together towards the same goal. This work has already started with a quality improvement project to improving communication on 2 wards where we're going to test out some more change ideas. And our goal is to continually improve the nature of the communication between patients, their families, and the hospital staff. Thank you.
So thank you, Ruth. Thank you, Jodie. What an incredible story. And of course, thank you to Tony and Lorena for sharing their personal story and experiences with us today. So I think, David, the floor is yours. I'm hoping we've got some questions. We're ready, and I'm joined by Jodie and Ruth, who we will invite in to answer the questions as they come through.
Great, fantastic. Thank you, Rachel. So we'll start the questions with a nice easy one, but really gets to the nub of the matter, which is, in your experience, what matters most to your patients? What do you find from a practical point of view matters most?
Oh, great. Who's going to go first? Should we all have a go? So I'll forward round to Jodie first of all.
So from all the conversations that we had, it was being connected with their family. It was really one of the most important things. And that was why we had to really quickly learn to adapt to be able to facilitate that. So,
Great, thank you. And Ruth?
I would say the same. That was absolutely vital for our patients to stay connected with their families. We had one lovely gentleman on my ward who really wanted to speak to his wife's carers at a particular time of day that they were in, and we knew that was between 5:30 and 6 o'clock every day. So that was a really key piece of information to share with the multidisciplinary team, so that whoever was looking after that patient that day, make sure that they helped him to make the call and get some information on how his wife was doing at home without him.
Okay, fantastic. So next question, is the service still happening?
Oh, Ruth, back to Ruth. You can see we haven't rehearsed any of these questions.
So the Family Liaison Clinicians, as Jodie mentioned, we were redeployed from our other areas of work to go and set up the service and run the service. As the hospital is settling back down into the new normal for us, we've gone back to doing the jobs that we were doing before. But that doesn't mean for 1 minute that we're not really focused on making sure that that communication continues at this high level, and that families are really enabled to stay connected. So I mentioned about doing a quality improvement project. I have 2 consultants who are leading on that piece of work with other members of the multidisciplinary team. And so we are going to be working really hard to make sure that we've got the best way forward for our communication. And we'll be asking families, we'll be asking patients, again, what really matters to them a bit about that communication, so we can be sure that whatever else we decide to implement will be spot on for them.
Great, and just to add to that, Ruth, I think it is about using the best bits of the service, learning from what we could have done even better, and embedding that within the way that our ward staff are working each and every day. And I know, certainly talking to patients who've had experience of our care pre-COVID, during COVID, and now as we start to go through our the restarting of our services, that they really value, and it really matters to them that they know that they've got people here that are helping them. So thank you.
Okay, next up we've got a question about hospital visiting, and this question is about when and how you're going to change hospital visiting arrangements, particularly with regard to maternity services.
Okay. That's a great question. I'll pick that one up. So we, throughout all of the COVID period, we've made sure that we apply all of the national guidance in its strictest form, and that includes visiting. And we've not done that alone. We've done that with our partners across the system, and with our partners who provide acute care across the rest of Hertfordshire and more wider afield, so that we're consistent. And therefore, if any of you are visiting a hospital here in Stevenage, down in Hertford, or indeed in Watford or Harlow, that you all experience the same guidance. So we are continuing to have limited visiting, and for our maternity colleagues and our birthing partners, that means one partner, and that is important that we continue with those limits and those restrictions for many reasons, not least because we want to learn from other hospitals where they've seen some small outbreaks of the infection, where the public are bringing that in with them, and we aren't able to limit and restrict that. So it's important to us that we keep you safe, that we keep our patients safe, and we continue to keep our staff safe. So limiting those visiting, the numbers of visitors, is really important to us for that reason. We realise that does place additional challenges, but we are continuing to work with you, and particularly maternity. We work with a group called our Maternity Voice Partnership, and these are our mothers that have had recent experience of having their babies with us, and we use their feedback and their experiences to help us with continuing to drive forward those services.
Okay, fantastic. So next question is, what is the one thing that you've learnt from the recent past few months that you're determined to as we move forward post-COVID, hopefully?
Is that, if we focus that particularly in relation to patient experience, otherwise we could be here all week, David.
Let's go for patient experience.
So in regards to patient experience, Ruth, did you want to start? And Jodie, perhaps? I think we've probably all got something that we would want to share.
Yeah, it's hard to say one thing. I think one of the most important things is to continue being able to offer families the help with phone calls and with video calls, because we feel that every single patient should be able to connect directly where possible with their loved one when they can't come and visit. So we are definitely keeping that initiative going, and we've got the devices to do that.
Thank you, Ruth.
Okay, can I just come in and ask our audience and viewers, please keep those questions coming. You can hit the Q&A tab just down on the right hand side, and then click on the plus sign, and that should enable you to ask your questions. So please do keep them coming.
Thank you. Jodie, for you?
So I think the thing that setting up this service and talking to families and sharing their experiences or what was important to our patients was actually that we developed a real partnership with our I say visitors, but they're not visitors, but with the people at home. And I think that was a really important thing. We often talk about a partnership working, but I think that was the one thing that we actually did do during that period. And I know work going forward with what I'm doing is we're continuing that partnership and always looking for our community's input on how we deliver the services in the hospital.
Thank you, Jodie. And Ruth alluded to it earlier, but just to remind everybody that we do have a staying in touch service as well, where loved ones can send an email, send a letter. We've sent over 500 letters, photos in through to loved ones whilst they've been staying with us, and visiting has been restricted, and that is available for all of you to access at this time. Any more questions, David?
So not exactly a question, but not wishing to embarrass you guys, you've got a big shout out from the very senior manager at the CCG who's just posted, "You should be very proud of what has been achieved. A big well done, thank you."
Brilliant.
Thank you.
So next question is, here's a good question. If I need care urgently, will I now receive it? So a question about coming into hospital in confidence, really.
Yeah, so again, that probably touches on the session that we're going to run on Wednesday. So Julie, our Chief Operating Officer, will be talking in a lot more detail about our Operation Restart programme. And we are starting to ramp up the services that we have. We've always offered emergency services and emergency care for all of our local population. So the short answer is yes, but we will start to share more of those details with you on Wednesday when we've got the wider exec team joining us.
Can I just...
And Jodie's going to add in.
So I just wanted to feedback from a carer that emailed me recently. So he came into hospital, I think it was about a week ago, and he ended up having a 2-day stay, and he fed back just the confidence that he felt in coming in. He was quite frightened prior to that, but he felt that all the processes that we had put in place, he felt safe. He said he spoke to the staff and they felt safe as well. So I just want to assure you, please, if you are unwell, our hospital service is open.
Thank you, Jodie. Thank you. And it will feel quite different for some of you that haven't been in the hospital for many weeks. It will feel very different. We are encouraging and enforcing the use of face masks, good exemplary hand hygiene. So it will feel quite different if you haven't used our services on any of our sites since the beginning of COVID. And, we've got people around that can help and support you with how you're feeling. But it will feel quite different. David, next question.
Yeah, okay. So I think this relates to the range of services that you developed for Stay in Touch. Will we get even more technology to expand support even further for patients?
Yeah, Jodie can answer that one.
So throughout COVID, we were supported quite positively by our IT team, and we got iPads and handheld devices which enabled us to do the phone calls and the video calls to the loved ones and our patients. So another project that we're taking forward, or one of the really good learnings that we're taking forward, is that we're going to continue the use of the IT technology to enable face-to-face calls and also telephone calls. And we're going to be setting that up with the use of our volunteer service.
That's great, Jodie. Thank you. And just building on what I'd said earlier about how the hospital feels quite different, we're also encouraging our clinical teams to work differently, using technology to enable us to ensure social distancing where possible. So on the wards, there might be virtual ward rounds where we'll have one of our consultants perhaps in with you as a patient, and then the rest of their team sat remotely somewhere else, using technology to interface between the consultant and the patient with the rest of their team. So lots of digital transformation, and I'll do a shout out for Mark, our Chief Information Officer, who is running a session on Friday, particularly highlighting some of the digital transformation that has happened, not least in the last few months, but also into the future as well. Any more questions, David?
Quite a nice little personal question that's just come in here. Someone said, great film. Do you know how Tony is now?
Ruth?
Yeah. So I can very happily reassure you that Tony is making a good recovery, back at home safe with his wife and his two grown-up children. So yeah, it was a happy ending for that one.
As there have been lots and lots, and I'm sure some of you will have heard all of those stories as we've shared them over the few weeks. So thank you, Ruth.
Okay, another question. I have an outpatient appointment. Can I feel safe coming into the hospital?
Yeah. So I think that's a good question, and probably I'll start, and then if Jodie and Ruth want to add in. So the hospital does feel different. We have ensured that all of the national guidance that has come out has been strongly and strictly adhered to. You will be asked to wear a face covering or a face mask when you're here. We do enforce social distancing, so there will be limited numbers of people that you can interact with. You'll be kept safe in the waiting area, so please do stick to the time that you've been given for your appointment, so we can limit the numbers of people within the outpatient areas. And you will then be guided through the hospital and the services that you touch throughout that outpatient appointment. So yes, you will feel safe. And as Jodie's already alluded to, we are frequently showered with feedback from patients and their carers and their loved ones that reminds us that the way that we are restarting our services is helping them to feel safe.
Okay, fantastic. So next question is, will this, and I guess that means the Family Liaison Clinician Service and Stay in Touch, will this be at the heart of the quality improvement and patient experience strategy of the Trust moving forward?
Yes, so again, on Wednesday, I'll spend a little bit of time talking about our quality strategy. I think many people now will be familiar with our 4 key pillars of quality and the improvement programs that we're driving forward. And absolutely integral to that is the patient experience. And all of what we do is about listening to what matters to the patient and putting that absolutely at the core of those improvement programs. I don't know, Ruth, do you want to, you're relatively new to the team pre-COVID. I think, had you been here for 2 months before COVID kicked off, and integral to some of our quality improvement initiatives. So I don't know if you want to add
No, absolutely. I think we are really focusing on the question about what matters most to you. And we're going to be doing a lot of work across the whole of the Trust to make sure that that question is asked for our staff, our patients and their families. It was What Matters to You Day a few weeks ago, and we did a big piece of work around the Trust, talking to lots and lots of members of staff to understand what mattered most to them. And we are right now in discussions about how we're going to make sure that all our patients and their families get asked that same question. And more importantly, what we then do with that information, and that we translate what they tell us into action, as we've described when we give some examples from our Family Liaison Service.
Thank you, Ruth. Jodie, did you want to add anything?
As Ruth and Rachel have said, I think the one thing that when we were asking the what mattered most to you question, there is, finding out the answer and seeing how that improved our patients' experience and also the families' experience was really one of the positive things that we've learnt from, and that is definitely one of the things that we are taking forward through our patient and carer experience.
Great. And thank you, Jodie. And just to remind everybody, we start our Trust board meeting. So this is important not just to us, but actually to the board and all of our colleagues. We start our board meetings with a patient story and grounding ourselves in feedback from patients and their loved ones about the services that they've had and what would make the care that we give even better with a few changes. So that patient experience is absolutely core to the work that we do each and every day. David, any more questions?
Yeah, we've got a great question here. How are you working with patient groups and charities as representatives of patients to understand what matters to them?
Great, that's good. Jodie, do you want to go first and then we'll wrap up?
So a lot of the work that I've been doing with looking at carers and supporting carers in the hospital has always been co-production with carer organisations and our public. So that is a really strong ethos, and it adds so much value to what we learn and what we discover, and actually to our patients' care. So I think co-production is definitely at the core of everything we do, and we'll be continuing that as we go forward as well.
And absolutely, and I think one of the things that we're all incredibly proud of is the engagement that we do. I touched on the maternity voice partnership, so our women who use our services, Caroline and her children's services have done a huge amount in engaging with our children, their carers, and of course our adults. We're really lucky, we've got a real ambassador for patient experience as one of our non-exec directors, Val, who is also very well connected with Healthwatch, and we work really closely with our Healthwatch Hertfordshire colleagues as well in testing all of our ideas and thoughts around changes to pathways and getting their feedback on the experience that our patients, our service users and their carers and loved ones have, and that's again integral to the way that we approach things.
Okay, coming to the end of the questions now, but one specific service question here. Can I use the Family Liaison Clinician Service if I want to talk to a doctor about my relative's progress?
I can take that as carer's lead. So one of the things going forward, and something that I've been promoting with our carer organisation, is that if anybody at the moment still needs to have a telephone call or wants to facilitate that close relationship, please give me a call or contact me, and I'll be able to help facilitate that with you. My details are on the website, so if you go to the Trust website and search Carers Lead, there will be some information there.
Great. David, is that the end of the questions? Because I think Ruth's got something she just wants to add before we conclude.
Yeah, of course.
Can I move around to Ruth again?
Thank you. So I just wanted to say my normal role when I'm not being a family liaison clinician is to be a coach for quality improvement projects throughout the trust. That might be in adult or children's services. And one of the things that we're really focused on is making sure that we always have patient or carer input into any project work. So we're not making decisions as a team about what we think is best for our patients and their families. We're actually inviting you to be partners in that work so that we make sure that we do get it right and your voice is really heard and influences and shapes any changes that we're going to be testing out in practice.
Thank you, Ruth. So I think that brings us to the end of our inaugural AGM session. A huge thank you to Ruth and a huge thank you to Jodie. I started off by saying I'm incredibly proud to be the chief nurse here, and I think, you know, listening to the stories that we've heard in the last 45 minutes just remind me of why we're lucky to do the jobs that we do. We're lucky that we've made a difference to so many people over the last few months, and indeed many months before. So this isn't something that's just unique to COVID. So look out on the website for the next sessions. We've got special AGM sessions running each and every day this week. Tomorrow, Duncan is doing a session on our people. Great to have your feedback. I'm sure I will get a telling off. I don't remind you all to give you feedback and scores on the door so that we can make our next session even better. A big thank you to each and every one of you that has taken up some of your evening to listen to all of us this evening. And as I said earlier, a big thank you to Tony and Lorena for letting us share their story with all of you. Big thank you and go safe.